Good afternoon. Good afternoon. My name is Lindria Wynn. I serve as the Enrollment Director here at Impact Health Sharing. I know a lot of you are excited to learn more about Impact Health Sharing, and we are excited to see so many of you here today. We know your time is valuable, so we plan to give you a pretty strong overview of the Impact Health Sharing program and answer many of those most commonly asked questions. Our goal at the end of today is that you know exactly what you need to know about the program. We want you to feel educated about your decision for healthcare, and we will have a brief time for questions and answers at the very end. But in the meantime, let's jump right in. So affordability and pricing gets a lot of us excited here. So I think that's a really good place to start. Impact is extremely proud of our pricing model and how incredibly simple it is to get an individual household quote. To get pricing, we simply need the date of birth of the eldest person in that household and the desired household size. So the household sizes are broken down into 3 different categories. So 1, 2, and 3 or more, okay? The monthly share prices you'll see is what your household is responsible for monthly. That's most closely associated with a premium, okay? That's what you can think of. The associated PRA or primary responsibility amount is what your household is responsible for paying towards eligible bills collectively, okay? That's a big, big thing, collectively, before any of the other eligible expenses are shared with the other members. So I wanna give you a really, really good view and provide you with a quick scenario, okay? A family of 4 joins the Impact membership and they select the $2,500 PRA. The son in that family ends up falling off of his bike and breaking his arm. So let's talk about what's going to happen. Immediately, mom and dad are taking that child to the emergency room where when they get there, they will present their Impact Health Sharing membership card. Okay, right on the front of it, the ER attendant should see that the associated provider fee is $150. So they can anticipate paying that $150 at the time of service at the emergency room. They're going to do whatever they need to do to make that child well, cast them up, get him some pain medication, and send him on his way. In a couple weeks, Impact should be getting a bill directly from that provider. One of the first things that we do on behalf of the family for every medical bill that we received is look and to see what they were actually charged for. That process that we're utilizing is actually called reference-based pricing, where we reprice the bill based upon what we know is both fair, for both parties. So let's just say for easy math, the family was charged $5,000 by the provider. That's the bill that we received. The very first thing that we're going to do is reprice that bill. And let's just say we've got the bill repriced to $3,000. So you will actually be receiving something in the mail called an explanation of sharing, an EOS for short. This is going to be a document that's mailed directly to that family, and they'll see instead of the $5,000, they're actually responsible for that $3,000. That's eligible for sharing because of the broken arm being an eligible expense, okay? So now, for easy math, you had that $2,500 PRA. You are responsible as that family for the first $2,500 of that remaining $3,000 bill. That is your responsibility. That is going to satisfy the entire household PRA for the family for the year. That leaves $500 remaining that is now eligible to be shared. After your household PRA is satisfied, you are then responsible for 10% of any future eligible medical bills for the rest of the year. So that $500 that's eligible to be shared, you're responsible for 10% of that. That means that $50 is going to go towards your co-share. The remaining $450 is going to be matched and allocated with the remaining members within the program. All right. Now, one of the best things that I want you to kind of realize is that you as a family, you've already satisfied that $2,500 PRA. You've already satisfied $50 of your co-share. So moving forward, if anyone else in that family experiences something eligible during the year, they're only responsible for the provider fees when they get there and that co-share amount, which is 10% of any future bills. All right, so I hope that makes it crystal clear with how the program will actually work for you. Now, you'll notice in the scenario that I just gave, I used some different terminology than you're probably used to. And the primary reason for that is because impact health sharing is not insurance, okay? We take a not-for-profit approach, meaning that unlike insurance, where they put your insurance premiums into this massive pool, Impact puts the power of affordable healthcare back into your hands as a consumer by sharing those costs directly between the members. And we notify those members whenever their reserved funds are used to pay another member's eligible medical bill. Okay, so that's where that matching and allocating comes from. Our program is membership-based. That means that every single household is here voluntarily. There are no contracts, which is why Impact Health Sharing is not able to offer a promise to pay or guarantees. Unlike insurance, who actually they predetermine what's covered based upon a pre-selected plan, Impact uses membership guidelines to outline bill eligibility. All right, so while we're here, let's take a little bit of a deeper dive into what's considered to be an eligible medical bill. Impact's definition of an eligible medical bill is any new, emphasis on new, accident, illness, or injury. Impact also deems the American Cancer Association's recommendations like mammograms, PAPs, colonoscopies, PSA tests. Those are also considered eligible. Even well child care for children 6 and under is also considered to be an eligible bill. So let's think about this. Why is that important to understand? It's because your PRA, that primary responsibility amount, can only be satisfied and met with eligible bills, okay? All eligible bills are subject to your household PRA, which means it must be satisfied first before anything eligible gets to be shared among the other households within the membership. Medical bills that are linked to pre-existing conditions or anything that you've had a sign, symptom, treatment, testing, or diagnosis for within the past 36 months would not meet eligibility requirements, okay? And therefore, those expenses would be out of pocket for you after Impact has had the opportunity to reprice that medical bill that we received from that provider. Okay, it's important for you to think about anything that you have currently going on, maybe anything that you're taking a prescription for at the current moment, as those conditions are specifically, they're pre-existing, they qualify automatically because you're already treating them. Okay, keep in mind pre-existing conditions in no way exclude you from Impact's membership. So I want to make sure that's clear. You simply want to understand how bills received for them would be handled. So let's explore this a little bit more. There is still substantial value for prospective members who may have a pre-existing condition. As a member of Impact, you'll still have the privilege of saving on bills related to a pre-existing condition because of Impact's process of repricing any and all medical bills that are sent to us by your provider. All right. In addition to that amazing value, Impact offers access to wholesale prescription prices for any prescription, even those that are taken for a pre-existing condition. This means that while your bills and prescription costs are eligible for sharing, you still receive value of saving for anything related to a pre-existing condition. Now, I want to take a moment and highlight some of the incredible features that come along standard with the Impact membership, regardless of your selected PRA tier. So that's really important. Your PRA selection process should solely be based upon what you could afford if something were to happen and what you can take care of monthly. All right, so every membership year, Impact includes one annual physical per member within that household. This physical is shared at 100% by the Impact membership before, emphasis on before, your household PRA or co-share is met. That means that your annual physical is not subject to that PRA. In addition to that, Impact offers an annual $150 lab allowance for the labs related to that physical. More information, if you're curious, which labs those actually are, more information on which labs they are is listed in our membership guidelines underneath the wellness section, specifically on page 12. So if you're interested, go ahead and check that out to see exactly which ones those are. And I must say, one of my absolute favorite features, and if I'm honest, probably my most used, is the telemedicine feature. I have young children, 5 and 6, so they never get sick during office hours. It's always after office hours. You can log into your Impact member portal and schedule an appointment with a medical provider at any time of day or night and receive medical assistance. The cost for telemedicine within the Impact member portal is $0. That's right. No upfront cost to you, and the visits are unlimited. You can be seen for any of those non-emergency situations and even get a prescription sent to the pharmacy of your choice. So I want to make emphasis, non-emergency situations. If you're having chest pains, definitely go in to see someone, but it is for those non-emergency situations. Again, if you are given a prescription or written a prescription during your telemedicine session, you again get to capitalize on that value of a wholesale rate. All right, so typically if we were on a call together, I would ask you around this time if you have any additional questions or specific questions about something that I've discussed previously, but since we're all here virtually, I'm going to take some time and answer a few of your questions that you actually sent in prior to or even during today's webinar. All right, so the very first question we have is, what happens if my provider won't accept my card or bill Impact? Perfect question, great question. I'm so glad that you asked that question. So as an active Impact member, you will experience that every now and then. The primary reason for that is because Impact does not have a network, okay? You are free to visit any doctor or physician of your choice. That means when you walk into the provider's office, you display your Impact card, they may or may not be familiar with the concept of healthcare sharing. So here's a little tip. One of the first things you'll want to do, flip that card right over. Typically the lady at the front desk, the individual at the front desk will take a look at the card and they'll see right on the back there is an EDI where they can electronically bill Impact. However, if they're still not familiar, have them call the phone number right on the back. Someone here at Impact can easily explain them through the process of sending us a bill, okay? And we've had much success with that process when they simply make a quick phone call. However, in the event you get into a situation where they're still not willing to send that bill or even make that phone call, it's okay. You can still frequent that provider. What you will do is ask them for the self-pay rate. Typically within the industry, they'll take a pretty large percentage off of the retail price for your visit, and you will pay for that visit upfront in full when you get there, okay? One of the things that you need to be asking for, you want to ask that the billing department, in addition to your receipt, but you want to ask for a HCFA, that is HCFA, HCFA 1500 form, or a UB 040 form. That's more for the outpatient procedures and things like that. But you want to ask for that super bill that they would typically send to an insurance company. It's a HCFA 1500 or the UB form. Ask them to send that directly to you so that you can take your receipt, that form, and you can submit a medical expense form directly through the Impact Member Services team and through a portal. From that process, we can actually take whatever portion you've paid, even if it's more than what we would have gotten it repriced by, assuming those bills are linked to something eligible, we're going to take that amount that you've paid and apply it to your PRA. If you've already satisfied your PRA, you'll be reimbursed based upon where you are in the co-share process, okay? I want to make some greater emphasis on this. You don't have to get frustrated or flustered if they won't take the card, especially if you haven't met your household PRA. because no matter what, whether they send us the bill or not, you still have to satisfy that PRA first, okay? So whether they've sent us the bill or you pay for the bill up front, the household PRA still has to be satisfied with eligible bills first. I want to give you a quick tip as well. If the visit that you're there for happens to be your annual physical, keep in mind that's shared at 100%. So what does that mean? You're going to take that HCFA form as well as the full self-pay rate, submit it to Impact. You'll be reimbursed 100% of whatever you paid for that annual physical cost. All right. Great question. Number 2, what happens if I get a bill that exceeds the $500,000 annual sharing limit? Great question. Another great question. One of the things that you want to keep in mind, meeting $500,000 is quite an act, but it can happen, especially in those unfortunate situations of a medical emergency or some unforeseen cancers, things like that. So it can happen, but the likelihood is extremely rare. If you have a moment, I encourage you to take a look at one of our Impact blogs right on the Impact website. We did have a member who was diagnosed with cancer, and she had bills that were sent to us that exceeded that $500,000 limit. However, once our billing team got a hold of it and we went through our repricing process, we got those bills knocked down substantially in that $30,000 range, way, way, way below that $500,000 sharing limit. So keep in mind the $500,000 sharing limit is still subject to the repricing, which we're going to advocate on your behalf and ensure that we're taking care of the reserves for everyone. So we work really, really diligently, and we're really proud of the savings that we've been able to provide our membership thus far. Now, if you're one of those rare individuals who, even after the repricing and all of the things that we're able to do on behalf of our Impact membership, even if you're still over that threshold, we have an extra layer within the Impact membership called Extra Impact. It is an internal charity. Thanks to the generosity of our Impact membership, we actually have many, many members who are actually donating monthly on top of their monthly share to this Extra Impact initiative, where families who have happened to fall in that category where they do exceed it or they do have eligible bills that are outside of that threshold, they can apply to the Extra Impact program as well to potentially get that assistance as well. Okay. Great question. Number 3, for people who are 65 and on Medicare, how does Impact work? So I'm really, really glad that someone is thinking ahead. So Impact can service individuals who are Medicare aged, again, 65 and older, and have Medicare Parts A and B. Those two are mandatory. All right. Instead of it being a family situation where they have the option to add on spouses and children, because Medicare is single, so is the 65 and older or the Impact for Seniors program. That means that if they're this couple over the age of 65, they would both individually have 2 Impact for Seniors programs. I'll explain how this works. As long as you have Medicare Part A and B, and you are 65 by your start date, you can enroll in Impact Senior Program and you would be able to have a $1,000 PRA, okay? One of the things that I absolutely love about this program is that Impact considers eligible bills a little bit differently for seniors exclusively because they have that extra layer of Medicare. Basically, anything that Medicare covers, and think it's massive, anything that Medicare covers, Impact will deem eligible, okay? So anything Medicare covers, Impact will also share in once that $1,000 PRA threshold has been met. Also, something to keep in mind, the senior program does not have a co-share. That means after that $1,000 PRA has been satisfied with any of those out-of-pocket expenses, like your co-pays at the doctor's office or deductibles or things of that nature, after you've satisfied $1,000 out of your pocket, Impact's membership shares 100% of that remaining 20%. If you're not aware, Medicare covers 80%. And that's why people typically go and shop the marketplace to get some type of subsidy or a secondary. Impact would be operating in place of a supplement that you would traditionally shop the marketplace for, okay? But again, no co-share for the senior program. And basically that goes on for the entire year, just like any other program. One of the biggest pieces to remember, again, pre-existing conditions are not pre-existing conditions when it comes to the 65 and older team. And I do want to say we highly encourage Part D, that's Delta as well, because if you have Part D, prescriptions that you're currently purchasing every month underneath that Medicare branch, you can also have that cost credited towards that $1,000 PRA. All right. So really, really great question. Question number 5, or question number 4, can businesses sign their employees up directly on your website? So the short, fast answer to that question is no. They actually have a completely separate group enrollment process that I oversee. So if you happen to be a business owner or someone who's, maybe a couple businesses like, hey, this might be a really great and affordable option for them, I'll tell you to email us at groups, that's group with an S, at impacthealthsharing.com. Send over your inquiries to groups@impacthealthsharing.com. I can talk to you a little bit more about the group enrollment process and what that entails. Also, if you're a business owner attending today and you were referred by someone, definitely circle back with that individual to find out how you can make sure that your business, your group is enrolled through that individual as well. All right. Number 5, how does Impact's prescription feature work? So I'll put a little bit more emphasis on it because I think it's really important for you to understand some of the primary differences here. Whenever you go to the Walgreens or the pharmacy of your choice, keep this in mind. It's not like traditional insurance where you're simply paying for that fee or you're going through and they're sending the bills to Impact. That's not what's happening. When you go to the Walgreens or the CVS or your pharmacy of choice, you're responsible for paying that discounted and wholesale rate in full when you get there. What you would be doing is submitting those receipts for the eligible prescriptions. Again, anything linked to something new, those can be credited towards your PRA and those can be shared as well. But again, what's going to happen since you're paid 100% of it at the time of service, you would either be having that eligible prescription credited towards the PRA or reimbursed based upon where you are in the co-share process. All right. There is a group and a bin number right on the front of your Impact membership card. So any pharmacy that you go to, they're able to run that wholesale rate, even on things that we know are, name brand prescriptions where they're typically very, very, very expensive. There's still going to be a wholesale rate, even on name brand prescriptions. You do get that feature as well. All right. Our final question is, in what states is Impact Health Sharing unavailable? So we're proud to say that Impact is in 47 of our 50 states. The only states that you cannot currently reside in, meaning have a primary residence in and join the Impact membership, is New Jersey, Rhode Island, and Washington State. Okay? All right. Within the next few days, you will be receiving an email containing the recording from today's webinar. So feel free to rewatch. And if you missed today's webinar, go ahead and watch it for the first time and even share it with others who you think this might be a good fit for. Maybe they're interested in learning a little bit more or even joining our Impact family. We'd love to have them. Many of you may be ready to apply now, and I hope that is the case. There will be a link to do so in the email to follow. If you were referred by someone today, I encourage you to make sure that you circle back with that individual that introduced you to the program to find out how you can apply with them as your referral. If you have any additional lingering questions about the program that were not addressed in today's webinar, feel free to chat with us online, okay? We're always happy to assist. And if you're still on the fence, like there's still some personal things that you're wanting to get some clarity on, I completely understand. Please give us a call directly. One of our enrollment specialists will gladly assist you. I want to say thank you. I want to say thank you again for spending this time with me this afternoon. It is Valentine's Day, so I hope that you spread the love today. Have an incredible rest of your day. And if you are considering joining the membership, I want to proactively say welcome. Again, thank you for your time. Enjoy the rest of your day, everyone. Bye-bye.